Fascia iliaca block. This video will demonstrate how to perform a fascia iliaca block using the landmark approach. Before starting the procedure, confirm the patient details and indication, rule out contraindications, obtain informed consent, and ensure that you have the right assistance, monitoring and equipment. For the procedure, you will need to gather skin antiseptic solution, 40 ml of a long-acting local anaesthetic, 1 to 2 ml of local anaesthetic for skin infiltration, a sterile dressing pack including sterile drapes, a drawing up needle, an orange injection needle, 2 20 ml syringes, a 5 ml syringe and some swabs. Confirm patient details and indication for the block. Gain informed consent for the procedure. Ensure ECG, saturations probe and non-invasive blood pressure is attached. Position the patient correctly. Prepare your equipment and draw up the local anaesthetic such as 20 ml of 0.25% levobupivacaine using the blunt needle into each of the 20 ml syringes. Draw up 3 ml of 1% lignocaine using the orange injection needle. The landmarks for the procedure are the anterior superior iliac spine and the ipsilateral pubic tubercle. Place one finger on each of these bony landmarks and draw an imaginary line between them. Using your index fingers, divide this line into thirds. At the junction of the lateral third and medial 2/3, make a mark. The insertion point will be 1 cm distal and lateral to this mark. Locate the position of the ipsilateral femoral pulse. This should be palpable approximately 1.5 to 2 cm medial to the intended injection site in order to avoid inadvertent impalement of the femoral nerve. Prepare and clean the skin with 0.5% chlorhexidine. Infiltrate the skin superficially with 1 to 2 ml of 1% lignocaine at this point if chosen. Using the blunt red drawing up needle, pierce the skin at right angles to its surface whilst keeping the skin taut. Keep the needle in the sagittal plane to avoid the neurovascular bundle which lies medially. Advance the needle through 2 distinct pops as it perforates first the fascia lata and then the fascia iliaca. Advance the needle a further 1 to 2 mm. Aspirate and if negative, inject slowly. There should be no resistance to injection. If there is, the needle is likely to be in the iliacus muscle. In this case, withdraw the needle slightly until the injection is easy. There should be no pain or paresthesia on injection. Inject the first 20 ml slowly, aspirating every 5 ml. Then change the syringe, aspirate and inject the remaining volume. Withdraw the needle at the end of the procedure and apply a little pressure to the area for up to 2 minutes. Ensure that the patient is comfortable and that observations are checked every 5 minutes for 15 minutes, at 30 minutes and 4 hourly thereafter. Ensure that the block is clearly documented in the patient's notes.